I just want you to know you all are leading a national change. This is a plague on our country, right? Violence, community violence, and it has been neglected in our community for far too long. And we're fighting at a federal level to make sure we can bring billions of dollars to community violence intervention work. Health equity is challenging, and leadership isn't a solo project. Leadership requires a knowledge network. It requires relationships.
We just kind of pause to figure out what
this fellowship has given me an enormous opportunity to connect to leaders who are on the cutting edge of health equity nationally, who are engaged in some of the most important problems we face as a society, and we get to really be on this journey together.
So one of the fantastic things about having the fellowship here at Yale is that Yale, and the School of Management in particular, really provides an opportunity not just for the practical exploration of diversity and equity in business, but also provides this really incredible academic laboratory to really delve into issues at a deeper and more substantial level than you can otherwise.
One of the biggest problems that my community faces, and that is largely the community of pediatricians and pediatric providers, is this idea of how do we actually make medicine equitable. I care for our, Black, brown kids that are on public insurance, and sometimes that directly conflicts with the business of medicine, right? Those aren't the patients that are bringing in the most money. Those aren't the patients where we get the best reimbursements. But if we're able to understand why health equity matters and why bringing patients into a place that honors them, cares for them, and supports them is actually good for business and will bring more patients in, is what I want to do, and partly why I chose this fellowship.
So what I love about Yale is our mission to educate leaders for business and society. And so our classes are truly integrated, and I really appreciate that professors elevate examples in healthcare and finance and energy, really thinking about the business case for health equity.
I'm most interested in my current work about developing the future physician workforce. And so our workforce class has really kind of expanded my imagination about what is possible to build workforce capacity that increases the knowledge about mental health awareness and also to address community member needs when it comes to their mental health and their distress.
I had been a pediatrician for a long time, working in a pretty marginalized community, and just feeling like as much as we were working, when we weren't accomplishing the kind of outcomes that we wanted to, and really wanted to focus on cross-sector approaches to promoting and protecting the health of children. This has provided me the skill set to be able to do that.
I've been amazed at how much this has opened my eyes to new possibilities in thinking about partnerships. We serve low-income migrant farm workers, and I wanted new and better ways to think about equity other than just being there to provide services the way that we always have. I wanted to reimagine the equity space, and I wanted to ask harder questions. So to be surrounded by other students coming from the public sector, from the business lens, and thinking about how we might combine forces to deliver healthcare in a different way has been really inspiring. And I just think that I've learned how to ask bigger and different questions. It's made me think differently, and I've really appreciated the insight that I've gotten from my classmates.
We're so excited to have you on this service, and what a star student you are.
One of the things that I've come to realize in almost 2 decades of practice is the need to really have people who are decision makers and policy leaders who are trained on issues related to minority health leadership and policy.
We are committed to creating that generation of leaders in health equity. Our fellows can come here to do our EMBA program while they maintain their employment at their current job, while they continue to be deeply invested and involved in health equity locally, nationally, on a global level as well.
The process of becoming a better leader is really continuous quality improvement, but the fellowship really accelerates that process like nothing else I've ever seen. I believe right now I'm a better leader than I have ever been, particularly in issues of helping underserved populations. And I believe that by the end of this fellowship a year from now, I will be absolutely ready, primed, and charged to get out into the world and make some big differences for some people who really need it. I'm to man.
My name is Nia.
I'm Makai,
My name is Alicia.
I'm Fatima.
My name is Stephen.
and I am a Pozen
Commonwealth
Fund Fellow.